Perform hand hygiene. Cover all surfaces of hands with hand sanitizer. Rub hands together until hands are completely dry. Explain the procedure to the resident. Provide for residents' privacy. Put on gloves. Position resident on bedpan safely and correctly. Raise head of bed to comfortable level. Leave tissue within reach of resident. Leave call light or signaling device within reach of resident. Step behind privacy curtain to provide privacy for resident. Lower the head of the bed if it was raised. Gently remove the bedpan. Hold the bedpan for the RN test observer while an unknown quantity of liquid is poured into bedpan. Place graduate on level flat surface. Pour bedpan contents into graduate. With graduate at eye level, measure output. Empty equipment used into designated toilet or commode. Rinse equipment used and empty rinse water into designated toilet or commode. Return equipment to storage. Wash or assist resident to wash and dry hands with soap and water. Place soiled linen in designated laundry hamper. Remove gloves turning inside out as they are removed and dispose in trash container. Record output in millimeters on the previously signed recording form. Candidate's recorded measurement is within 25 millimeters of RN test observer's reading. Place call light or signaling device within easy reach of the resident. Maintain respectful, courteous interpersonal interactions at all times. Turn on water. Wet hands and wrists thoroughly. Apply soap and rub hands together using friction. Scrub hands for at least 20 seconds. Interlace fingers with fingertips pointed downward. Wash all surfaces of the hands and wrists. Clean fingernails by rubbing fingertips against the palm of the opposite hand. Rinse hands and wrists thoroughly under running water with fingers pointed downward. Dry hands and wrists starting at the fingertips using clean paper towels. Discard used paper towels. Turn off the faucet using a clean, dry paper towel and discard it. Do not recontaminate hands at any time during the hand washing procedure.